to Faces of Parkinson's. I'm Robert Cochran, and with me today on the phone is Dr. Brent Bluett from the Lou Ruvo Center for Brain Health. I think I got that right, yes?
You got it correct, sir.
Woo, there's one. Okay. Thanks so much for taking the time to join me today. Dr. Bluett, may I call you Brent?
Of course you can,
Very
yes.
good. Brent, tell me first of all your connection to Parkinson's. I know you are a neurologist, and perhaps there are some other letters I'm not quite aware of in your title.
Yeah. So I was a neurology resident, and I was trying to figure out if I wanted to subspecialize and what subspecialty in neurology. And so I went to the University of Miami and I did a rotation for a month in movement disorders. And I was trying to figure out if I wanted to do movement disorders or stroke. Movement disorders encompasses Parkinson's and other kinds of tremors and walking difficulties. Stroke obviously is stroke. And when I started working with the population, with the Parkinson's population, I basically fell in love and just realized they're the sweetest people in the world. They need help. The treatments actually are effective, so I can do good and not just diagnose. Yeah, that's how I got connected to it.
May I ask you, why did you decide to become a doctor? What got you interested and motivated, and then why toward neurology?
Yeah, so I've always been interested in helping other people. And so first I was going to do psychology, and I actually worked at a house for schizophrenic patients when I was 19 years old, and I was a mental health worker. And I watched 13 schizophrenic patients alone without any training, and that kind of scared me out of the field of psychology. So then I ended up going to medical school thinking, okay, I can make more of a difference this way. I can actually prescribe medications. And after seeing schizophrenia and the effects of it, I realized that psychology and psychotherapy alone wouldn't be able to help. So decided to go into the medical profession, and that's how I became a doctor in the first place.
It seems from when I've heard you speak, and even now, that part of, I think, your success, part of what you do well, is you relate well to the patient. You communicate well. It's not just that you have the information. And then also there's a sense of humor that I know goes with what you do. Talk to me about that, because dealing with 13 schizophrenic patients on your own with no training, I'm sure that was part of it, but talk to me about humor and bedside manner.
Yeah, I think that's the most important part. I had the unfortunate and fortunate experience that my mom had colon cancer my intern year, and she actually had it during medical school. And I decided to go to Cincinnati to be with her for my intern year because I thought it might recur, and it did. And I saw what it's like on the other side of the fence, for patients. And she didn't get the best treatment. She drove 4 hours to Ohio State from Cincinnati to be part of a clinical trial where she waited up to 10 hours in a waiting room for chemotherapy. The doctor wouldn't call her back for 2 to 3 nights or 2 or 3 days while she threw up on the bathroom floor every night. So seeing those things firsthand and with a loved one made me experience and understand the importance of relating to patients. And it's not really a patient, it's a person. And if you can't see that, then maybe this isn't the right field to be in.